Let me just confirm that about the recording. There we are. Okay, we are officially recording now. And I'd just like to say once again, good morning, everyone. My name is Sabrina. I will be your hostess for this event. Please mute your mics since we may have M3s on rotations popping in and out of this session. M1s and M2s are invited as well, so I'm glad you're with us. Be listening in, asking questions. I will monitor the chat box. This event is recorded, so anyone who could not attend or miss a piece of this session, you may rewatch it later. I'll send you guys an email out, so don't worry about that. Now I'd like to introduce you our honored guests from the Medical Board of California. First, we will begin with Ms. Marina O'Connor, Chief of Licensing, and then followed up with Dr. Jim Nuovo. I hope I said that correctly. Thank you both for being here today to chat with us about licensing. As I mentioned, I will be monitoring the chat box for any questions, and there's an email address in the chat box for you guys to ask questions as well. And we will have a Q&A session at the end for anyone who has questions. So we'll try to get all those questions in. So our students today include some from first years to third years, CUSM admin, staff, and community. And I just want to thank you all for being here and taking the time and showing your interest, and especially our honored guests today. And let us begin with Ms. O'Connor. When you are ready, I'll turn it to you. Thank you so much.
Okay, thank you, Sabrina. Good morning, everyone, and thank you for putting this together. I'm glad we can be here to provide you guys this information. We still have state travel restrictions in place, so at least we could use MS Teams to do this remotely. And of course, as Sabrina said, we have that email address which you can email. There's also additional contact information on our board's website as well. So I'll just go ahead and share my screen now. If you just give me 1 second here, make sure I do this correctly. Okay, so if everyone can see that, it should say Medical Board of California with my name and title, and then it also says Rhonda Baldo. Unfortunately, she wasn't able to make it here today, but if you send questions or emails to that email address we provided, she would be the one responding to your email. So you're likely going to have some type of correspondence with her if you do reach out to us through that email address. Okay, so we'll go ahead and get started. I'm going to go over licensing, the application process, and then I'll turn it over to Dr. Nuovo. So we did have a law change that changed the training requirements and licensure requirements in California that was effective January 1, 2020. So you may have heard of the PTL by now. We're about 1.5 years into this new law, so you may not know what a PTL is, or maybe you've heard of it, but it stands for a Postgraduate Training License. And what this does is it authorizes someone to participate in an ACGME accredited training program in California. So in order to get a PTL, you must be enrolled in an approved ACGME accredited training program in California. You must have received all your medical education and graduated from a recognized medical school and taken and passed an examination recognized by the board. Now, this part doesn't necessarily apply to you, but for international medical graduates, they must also be certified by ECFMG, the Educational Commission for Foreign Medical Graduates. So that's just kind of a high-level overview of what a PTL is. So a PTL is required, as I said before, for anyone participating in a California ACGME accredited program, and it cannot be renewed. It's issued one time, and it is not renewable. Once you have a PTL, the idea is once you meet all licensure requirements, you're applying for and obtaining a physician surgeon's license. And you may have heard of a PTAL, a Postgraduate Training Authorization Letter, or not. This is something that was under the old law, but I wanted to keep it under here because if you have heard of it, it's something the board is no longer issuing. This only applies to international medical school graduates, but the PTAL should not be confused with the PTL. So the PTAL is not the same thing. The board no longer issues those. So when should you apply for your PTL? So in current statute, you must obtain a PTL within 180 days after enrollment into an ACGME accredited postgraduate training program in California. So once you start your program, you have 180 days to obtain your PTL. So this should give you plenty of time to apply and go through the application process. And you by no means have to wait until your first day in training to apply, which I'll touch on later in the presentation. So as I had mentioned, the PTL is not renewable. It's only valid for 36 months. However, if you're going to be enrolled in a California ACGME accredited training program beyond 36 months, then we can issue the PTL up to 39 months. So that would just depend on the applicant providing, or the licensee, because at this point you'd probably have the PTL providing, documentation that shows, hey, I'm continuing on in my California training program after 36 months. So I need a PTL up to the 39 months. So we can do that if needed. But once a PTL expires, practice is not permitted in California without a physician and surgeon's license. So once it's expired, there's no practice. You should have your physician's and surgeon's license by then. So there's a couple ways you can apply. You can apply online through our website, which I'll provide the URL for that later, but it's very simple. It's just mbc.ca.gov. And you can apply online, as there's a picture here. There's a button to go through the online application process, or you can do it by mail. So we have fillable PDF application documents on our website. This is just a screenshot of the first page of the application, which again, you can get from our website, or you can apply online. You can do either one. However, we strongly encourage you to apply online. It's a much more efficient process. Also, when you apply online, you know that your application has been submitted to the board. Whereas if you mail it in, you may be wondering, well, did they get my application? Have they received it? We get a lot of inquiries regarding, did we receive your application? And we can't respond to those as timely because we're responding to questions regarding the application process. So you may not get a response right away to see if we've received your application. The best way to do it is online, because once you submit it online, it's done. The board has it. You get a confirmation. So I'm going to first go through the documents required for applying for the PTL, and then I'll go into each document in a little more detail and who's responsible for submitting which document. So, of course, as I mentioned before, we have the application form itself. We call it the PTL 1 through PTL 5. It's 5 pages of information you would have to fill out, answers you'd have to complete. Of course, you can, as I said before, do this online as well. There is an application fee of $491. You must be fingerprinted in California. So if you're physically located in California, you would just go to a LiveScan site, bring them the LiveScan form that is on our website. It's already filled out with the board information. You would just fill out your own personal information and hand them that form and get fingerprinted. It's a very quick process. We receive fingerprints within fingerprint results if you do through a LiveScan facility within probably 2 to 3 days tops. Now, if you're located outside of California, which you are not, but if you find yourself located outside of California, you would have to use what are called fingerprint hard cards. It's a much longer process. It can take months to get results for those hard cards. So obviously, if you're in California, just go to a LiveScan facility. And this is, again, only for international medical school graduates. They would have to submit an ECFMG certification status report. We also need official examination scores from the appropriate examination entity, whether it's USMLE or LMCC scores. We would need a certificate of medical education, an official medical school transcript, and a certified copy of their medical school diploma. We would also need, if you have prior training, if you completed training previously when you're applying for your PTL, we would need a certificate of completion of that postgraduate training, which we call the PTA, PTB forms, that just verifies what you've already completed if you had completed prior training. You would need to submit the postgraduate training license enrollment form. So this is telling us what program are you currently enrolled in or will you be enrolling in. And this form is very important because this form dictates how long we issue the PTL for. So if the form says you have an expiration, if the form says you complete your program on 6/30/2023, then we would most likely issue the PTL to expire on 6/30/2023, for example. Then we have the timeline of activities. If you've graduated within the last 6 months, we don't need the timeline of activities. You can always send it if you just want to be sure, but that's typically the cutoff we look at for requiring that document. You may need to provide an explanation for application question form. We call form EXP. This depends on how you answer the questions on the application, and the application will instruct you when you need to provide an explanation for application question form. So again, depending on how you answer the questions, you may need to provide this form as well. And then if you have or have been licensed in another state, you would provide a license verification as well. So just going into what you are responsible for as the applicant. So again, the PTL 1 through PTL 5, that is documents that the applicant should be completing and filling out and providing either online or through the paper form that you can print from our website and mailing it in. We, strongly recommend that when you do apply, you submit all of these things as soon as possible. Everything, whenever we don't get one of these documents, it just delays the review process and ultimately issuing the PTL. So, sending in the fee, we can't process your application without a fee. If we receive a form and no fee, the form will sit, it will not be processed. We do send you a notice saying, hey, we need your fee. We give you typically about 30 up to 45 days to provide payment, but we cannot process the application without a fee. And as I mentioned before, you need to get fingerprinted, so you'd be responsible for that process. We do ask that if you do the live scan process, if you go into a live scan facility, that you provide us a copy of your live scan form so we have a record that you were fingerprinted and we can look out for your fingerprints to make sure we get those, the fingerprint results. You would need to submit a timeline of activities again if you, fall outside that 6-month period I explained before. You might need to provide the explanation for application question form and the license verification. So these are all the responsibilities of the applicant. So these are the documents that the applicant would need to request from the primary source. So these documents must come directly from the responsible organization. So that if you're an international medical graduate, the ECFMG certification status report, you would need to request that from ECFMG. Your USMLE or LMCC exam scores would need to come directly from that organization. Your certificate of medical education, that would come from your school that you graduated from, as well as the transcripts and the medical school diploma. Your certificate of completion of postgraduate training form, if applicable, again, if you have prior training completed, that would need to come directly from your training program. So you would need to request these organizations to provide us all of these documents. The postgraduate training enrollment form, that would come from the program you're either currently enrolled in or going to be or are going to be starting with. So that would again need to come from the program. I had mentioned the certificate of completion of postgraduate training. That needs to come from the program as well. And these documents, the ones from the school and from the training program, they can be submitted electronically through our docs system, which is called the Direct Online Certification Submission System. We call docs. So the medical school or training program can fill out a docs registration form, submit it to us. We register that program or school, and they can submit these documents electronically to us rather than mailing them in. It's a much faster process. We receive the documents immediately as soon as they're uploaded. We don't have to wait for them in the mail. It's secure. We just, again, strongly recommend that the documents are submitted through our docs system. If your school or program are not already registered with docs, you can certainly, we encourage you to let them know that this service is available. All of the information is available on our website on how they can register in docs. So we do encourage that as well. Okay, so here are some time frames to be aware of. Some I've already covered. Again, the postgraduate training license must be issued within 180 days of enrollment in an ACGME residency program in California. If the resident has not been issued a PTL within 180 days, then you have to cease all clinical activities until the PTL has been issued. So you don't want to be in that situation. So you want to submit your application as soon as you can. The PTL may be issued up to 90 days after the end of the 36 month of training. I'd mentioned before we can issue it up to 39 days. So that's where this comes in. If you are going to be continuing training beyond 36 months in a California ACGME accredited program, we can issue the PTL up to 39 months. So I apologize. Here's some examples. So of the 180-day timeline, an example would be if you are enrolling in a program on July 1, 2020, then you would need your PTL issued no later than December 27th, 2020. So that would be 180 days. And just an example of the 90-day period, issuing a PTL up to the 39-month. For example, if your PGY3 ended on June 30th, 2023, then your expiration date of a PTL would be September 27th, 2023, if we were going to extend it to that 39-month time frame. So here are just some PTL rules and regulations to be aware of. We provided the statute reference here. It's Business and Professions Code Section 2064.5. But a PTL may engage in the practice of medicine in locations authorized under this subdivision, it's Subdivision B, and as permitted by the Medical Practice Act and other applicable statutes and regulations, including but not limited to diagnose and treat patients, prescribe medications without a cosigner, including prescriptions for controlled substances, if the training licensee has the appropriate drug enforcement agency registration permit and is registered with the Department of Justice Cures program. A PTL holder may also sign birth certificates without a cosigner and sign death certificates without a cosigner. So once you are issued a PTL, you will also receive a pocket card that identifies the name of the program you're enrolled in and the period of time of that enrollment. So that typically, you would typically get it around 2 to 3 weeks from the date we issue the license. That's about how long it takes to get the pocket card mailed out. It is possible that a PTL could be issued on a probationary status. So we could issue a probationary PTL. This depends on very specific circumstances, the information provided in the application. If there were anything of concern reported to the board, whether it was prior convictions or disciplinary action from other licensing entities, it doesn't necessarily mean you're going to be issued a probationary license. That's just information we use and we evaluate to determine whether or not we need to issue a probationary license. A PTL is subject to the same disciplinary process as a physician and surgeon certificate. And once the PTL is issued, it will be displayed on our website. We have a license lookup where the public can look up any license issued by the board. So once the PTL is issued, it will show up on our license lookup. So moonlighting. So according to our statute, the Business and Professions Code, PTL statutes, the holder of a PTL may engage in the practice of medicine only in connection with his or her duties as an intern or resident in a board-approved postgraduate program, including its affiliated sites, or under those conditions as approved in writing and maintained in the file by the director of his or her program. So that means a holder of a PTL may moonlight with written authorization from the director. So I just want to be clear on that. That is in statute. Okay, so licensure requirements. So this is once you're, you've gotten your PTL, you've completed your training. What's the next step? So the next steps would be pursuing your physician and surgeon's license. So to obtain a physician surgeon's license, you must successfully complete 36 months of postgraduate training. And this is whether you graduated from a domestic or international medical school. Training must be obtained from either an ACGME accredited training program, RCSPC, or CFPC if your training was obtained in Canada. So of the 36 months of postgraduate training, 24 consecutive months must be completed in the same program. This is very important. This is something, you know, that comes up, can come up, but 24 months must be completed in the same program. I just want to be clear on that. So, you know, 2 years in the same program, 1 year can be at a different program. So when you're transitioning from a PTL to a physician and surgeon's license, we call it a transition application. So after you complete your 36 months of training, you know, you should be transitioning to a physician and surgeon's license. So you would submit the transition application. Again, it's also on our website, the form, or if you want to apply online, you can. We call the forms online the TF1 through TF4. There is a licensing fee of $808. However, if you're currently enrolled in a postgraduate training program, you pay the reduced fee, which is half the full fee, which is $416.50. You would also need to submit passing scores of the USMLE Step 3 directly to the board. So we would need to make sure you've passed USMLE Step 3. Well, really all USMLE steps, but if you hadn't passed Step 3 yet, we would need that documentation. So the program responsibilities for when you're applying for your physician surgeon's license, from the program, we would need the completion of the postgraduate training form, which I had mentioned earlier, the form PTA-PTB. This must be completed by the program and sent directly to the board by the program. Again, they can use our docs system to submit it electronically, or they can submit it by mail, but we need this to show that what training has been completed. We use this to document that 36 months has been successfully completed. And then also the current postgraduate training verification form. This is the form CTV. This is the form you're going to need if you are applying for the reduced license fee. So if you're currently enrolled in a training program and you're applying for your physician surgeon's license and you want the reduced license fee, your program needs to submit this CTV form, the current postgraduate training verification form. And all these forms that the programs have to submit, they're all on our website. So I put any questions, but we're gonna, I think before we go into licensing questions, I was gonna turn it over to Dr. Nuovo, but I did want to point out, you know, this is a URL to our website, mbc.ca.gov. I did want to mention, you know, if I know this is a lot of information, so I strongly recommend looking at our website, checking out the application documents. We have an application information and checklist document on there, so you can go item by item, making sure you know what's required, how do you need to fill this out, what do you need to report on the form, etc. So I strongly recommend using that document, that checklist, when you're completing the application, or even before then, if you just want to get an idea, okay, I want to get a head start, make sure I know everything that's required, take a look at what's on our website at that checklist and start looking at what you're going to need to start putting together, requesting documents, etc. I will also suggest that don't have other, I wouldn't request documents from other programs, from your program or from your medical school until you've submitted your application, or you can do it simultaneously. What I mean is, if you're going to go online and submit your app, or you're going to mail it in, that's fine. But when you're going to request those documents from the other institutions, if we receive those documents from them before we receive your application, it can cause, it's a less efficient process, I'll put it that way. It can cause delays, because now we're having to hold on to documents without an application, wait for the application to come in, and then match it up. And so if you want a speedy, efficient process, submit your app around the same time you're requesting these documents from these other organizations, because when we receive these other documents without an application on file, it just can make it add time to our processing of the application. It's better to have for us an application on file when we receive the documents from the medical school or from the training program. So as the best you can align the timing of it, it'll lead to a much more efficient processing. So I just wanted to add that. Okay, well, thank you very much for your time. And after, I'll turn it over to Dr. Nuovo, and then I know we'll take questions at the end. So thank you.
Okay, thank you all. Thank you, Marina, and thank you, Sabrina. I'm just pulling up my PowerPoint presentation. I haven't used this before, so hopefully it will go well. Okay, so I was initially struggling with the title of this talk, and I thought avoiding trouble gets the message across. And just to give you some of my background, I'm a graduate of the University of Vermont College of Medicine. I served for 7 years active duty in the Army. I spent 28 years as faculty at the University of California, Davis, 14 as residency director, 16 as Associate Dean of Graduate Medical Education, and 4 as the Associate Dean of Student Affairs. On my current position, I retired about a year ago, as the Chief Medical Consultant to the Medical Board of California. I also serve as a hospitalist at our local VA in Rancho Cordova. For the past year, I've been doing a great deal of work taking care of COVID patients who are hospitalized. And I also just recently helped start a new family practice program up in Ukiah, about an hour and a half north of San Francisco, a rural program in family medicine. And what I wanted to do with the time I have is to just discuss the common reasons for complaints made against physicians and discuss the things you need to know avoid as a medical student, or understand how physicians may get in trouble with the medical board. And with any organization, it's always important to understand what the mission statement is of the organization. Just as your medical school has a mission statement, the Medical Board of California has a mission statement. And this is just simply a quote that the mission is to protect healthcare consumers through proper licensing and regulation of physicians and surgeons, through vigorous and objective enforcement of the Medical Practice Act, the regulations that govern the practice of medicine, and to promote access to quality medical care through the board's licensing and regulatory functions. Well, how many complaints come to the medical board against physicians? Approximately 10,000 complaints are received every year. And this slide here just kind of gives you, I know it's a busy slide, but it gives you a sense of, well, what the nature of the complaints tend to be. And most of them, about half of them, come with complaints from patients or family members concerned that the care they received was negligent or incompetent in some way. But there's a fair number of complaints that also fit the category of unprofessional conduct. And I'll go into that in just a little more detail as to what that entails and how that may be relevant as part of this discussion. Despite 10,000 complaints a year, roughly actions taken by the medical board against physicians are about 400 or so. And most of those relate to negligence or incompetence, those allegations that come through. But a fair number come through that are related to self-abuse of drugs or alcohol, mental or physical illness, and other forms of unprofessional conduct. And when it comes to substance abuse concerns, while just about any substance you can think of could be part of it, overwhelmingly out of 229 complaints in 2019 to 2020, overwhelmingly the majority relates to alcohol abuse. So how does this relate to you as a medical student? There's a researcher, her name is Maxine Papadakis. She's from University of California, San Francisco, and she's done a great deal of research on this subject over the years. And this was a paper that was published in a journal called Academic Medicine about 16 years ago. And what she did was a study of all UC San Francisco Medical School graduates over an extended period of time, looking to see whether there was any relationship between having problems during medical school and having problems as a licensed physician that resulted in discipline. And what she discovered was this: that problematic behavior in medical school is associated with subsequent disciplinary action by a state medical board. And if you're asking, well, what constitutes problematic behavior, It really relates to professionalism, and their point being that professionalism is an essential competency that must be demonstrated for a student to graduate from medical school. Well, they did additional work to try to understand what the domains meant. What did this really mean? Because if you try to define professionalism, I think we'd all come up with different terms to use to describe it. And this was a study that included Dr. Papadakis and some of her colleagues that was published in Academic Medicine a year later, looking at, well, what are more specifics? Can you give examples that would help us understand what this is? And what she discovered was that there were really 3 domains of unprofessional behavior that related to disciplinary outcome: poor reliability and responsibility, lack of self-improvement and adaptability. Lack of self-improvement really means you get feedback from your supervising physician and you don't take any effort to improve on that feedback, to incorporate it and to make changes. And poor initiative and motivation. You know, after all these years with all the work you've done, it's hard to understand that poor initiative and motivation can be a component of a medical student or a licensed physician, but the reality is that's true. And this is just, if you were interested in understanding this in more detail, this is a table directly from that article that I just mentioned about how poor reliability and responsibility, lack of self-improvement, initiative, and motivation are important factors. And there was another that was poor relationship with patients, families, student, faculty, and staff, difficulty getting along with everyone else. I know this past year has been a struggle for all of us in that regard. We've all been isolated in some way, but this stands out as unique. So is there a message I can give you? Yeah, actions you can take: be reliable and responsible. Listen to feedback. When you get feedback, listen to it carefully. Talk to others about the feedback you received if it's negative. I know most of the time as an attending, we're used to just saying, oh, you're fine, you're doing okay. But if you're getting feedback, such as, you know, you need to have more organized presentations, you need to make sure you're at rounds in a timely manner, that you're attentive to patients and their families, that those are important things to hear and important cues to make changes. To be flexible, I think you'll all learn that over time, that flexibility is an extremely important skill as a physician, and learning to be flexible and adaptable. And one really important one that I could talk for hours on is you have to take care of your mental health. Impairment due to mental health problems will cause harm to patients and will affect your career and personal plans. You saw my background. I have too many stories I can tell of people who didn't pay attention to their mental health, and the damage they did could be career ending. One thing I did want to talk about is substance abuse concerns. And this was a study that was published on prevalence, perceptions, and consequences of substance use in medical students. And this particular article showed that 91% of medical students consumed alcohol and used marijuana respectively in the past year. And importantly, about a third of medical students consumed 5 or more drinks in one sitting in the past 2 weeks. And they looked in a little more detail. I know this is a slide that's hard to see, but I could read some of the content for you, or you could review the slide later at some of the consequences experienced by students in the past year due to substance abuse. Like this is from the most common to the least common: had a hangover, got nauseated or vomiting, done something I later regretted. You know, this is a big deal. Sitting and drinking 5 drinks in the past 2 weeks, having a third of students do that. Certainly it's been a long time I've been in medical school, but I certainly remember heavy drinking was a common a common phenomenon. And I think if you want to do something, I was trying to show you this slide. This is an example of somebody who got into trouble for drinking. If you YouTube Miami physician attacks Uber driver, you can watch what actually happened. I will show you snapshots of what happened. This is a doctor who was a resident in neurology in a program in Miami. And it's never good when you get on Fox News and the title underneath your picture is "Doctor Suspended After Video of Her Attacking a Uber Driver Goes Viral." And this is her. What happened was that she was out drinking and she called for an Uber driver, and the driver showed up, but it was intended for another person, and she got quite angry at the driver. And the person who the car was intended for decided to take out their iPhone and start recording this. So that's her starting to fight with the Uber driver. And there's the Uber driver in the car that she was trying to get into. And here she is kneeing him in the groin. Again, this is a resident in neurology and a training program in Miami. She gets into the car and throws out of the window all of his papers and items in there and made a big fuss. And then it makes the news, the national news, even on ABC. And then she gets to have to explain herself. Her explanation, if you watch the video, is, well, that wasn't really me. I'm not sure that that's going to fly anywhere. And there they're showing a split screen of her attacking the Uber driver. Watch the video. Think of it yourself. Think of your friends, your colleagues who are who do binge drinking as part of the stress reduction for the challenges you face in medical school. Ask yourself, if you are somebody who's drinking that heavily, to reflect on this and get help, because this is something that could be career ending. She was fired as a resident in her neurology program. The hospital thought this was unacceptable behavior and terminated her. She ended up practicing primary care somewhere in the Miami area, changing her name. But this type of stuff can be career ending. So again, be reliable and responsible, listen to feedback, constantly work to improve, be flexible, understand we all make mistakes, we all make errors, none of us is perfect, but we have to work to constantly work to get better and take care of your mental health, the mental health of your family, your friends, your colleagues. There's nothing wrong about telling a colleague, I'm concerned about you. I think you ought to go get some help. An impairment due to mental health problems will cause harm to patients and affect your career and personal plans. So I'll get off my soapbox now and end my discussion and give you a chance to ask any questions. Thank you.
Okay, thank you for that. I'm going to check and see in the chat box. I don't see any questions. Okay. I think at this time, I just want to thank Dr. Nuovo and Ms. O'Connor for your information, your insights, and your expertise, and your willingness to share your time with us and with all this information that you shared. In terms of Q&A, I think maybe it'd be best to leave it to the email address that was left there. As I said, we had people kind of filtering in and out, and then we'll watch the recording, but very good information. I appreciate you taking the time and putting this together, and hopefully when we can meet in person, I know our campus is going back in person in the week of July, but July 14th, we'll all be back on campus, but perhaps if you guys are open to it, or we could still do virtual in the future, just like a Teams, we can maybe have this again, this session, if you guys are open to it. But I want to thank you both for your time. Are you open to that, guys?
Sure.
Yeah, it all just depends on, you know, the governor allowing state travel again for non-essential state travel. So we're just, I know with the state reopening soon, we're kind of waiting for direction on how that impacts our ability to travel. So it just, I mean, if we can, we definitely are open to it. Absolutely.
Cool. Well, thank you so much for that. And yeah, of course, we have to make sure everyone's safe and feels comfortable. And if the opportunity arises, I would appreciate having you both back. And, we'll have our first class of M4s next year. So maybe some reminders of some of this information again would be really helpful as well. But thank you both for your time. I will remind them of the email address. I'm going to check the chat box one more time to see if there's anything I might have missed. I think mostly we just had listeners for this one, but I want to just say thanks again and enjoy the rest of your days. Take care, you two.
Okay, thank you very much.
Goodbye.
Thank you. Bye.
Bye.